Good day. The course is Organization and Administration of Health. As health educator, you may eventually find yourself at the ends of affairs. So this course will specifically prepare you towards harmonizing both human and materials resources available for you in order to make your unit a formidable one or a successful one. So as far as this course is concerned, we will consider health programming. We look at the principles and practice of planning, organization and administration of health service at different levels, such as the unit, school, local government, state, national, and at international level. Thereafter we will look at school and other relevant agencies in health. We also consider the personnel in health and environmental program. What to do in order to ensure your health and wellness. And finally, school health program. Well, health programs in Nigeria is a set of actions developed by government with the aim of improving the health condition of the populace. Governments and its agencies promote preventive care and provide access to medical facilities. So government has different health programs which they provide for the people in the state. And among these programs include safe water supply, family planning and reproductive health, maternal and child health care, prevention of HIV/AIDS, malaria prevention and treatment in Nigeria. Government also do everything possible to improve on social infrastructure. There is a program on elimination of leprosy in Nigeria, school feeding program, school health program, expanded program on immunization, tuberculosis program, National Cancer Control Program (NCCP), mental health, tobacco use control program in Nigeria, polio control, community health programs, national health mission or non-communicable diseases. All these programs are vital to the health and wellness of the people. However, in planning any health or meaningful health program, there are basic things that need to put into consideration, and among those things include the program must have clear vision, goal and objectives to achieve, a clear vision of the task to be accomplished. Likewise, the resources necessary to accomplish the task must also be made available, such as human resources, material resources, logistics, money, time, space, and the necessary health information. All these must be well considered when formulating any health program, and it must be collectively done, and the necessary professionals must equally participate in such a program. Health program can be health program and planning may be in two folds. The first one is strategic planning, and this may likely take longer period of time, normally between 5 years or more. Then the second type is tactical operational planning. This consider the target population, the nature of the program, the aims to achieve, the factors, environmental factors that must be considered, on and so forth. Meanwhile, there are some basic factors to consider in planning health programs, and among these factors include system analysis, This simply means that the problem must be clearly identified. The likely causes must be identified. Then this will lead to situational analysis. So after that, there must be selection of critical issues, like priorities should be given to those conditions that are highly dangerous to health and well-being of the people. Then besides that, there must be objectives and targets. This simply means that the setting of the objectives and what that objective intends to achieve must be identified. Then there must be identification of potential obstacles, what may likely hinder the program or the planning. Likewise, strategies must be designed in order to manage whatever obstacles that might have been identified. Then finally, there must be writing of action plan that involves what is necessary to do in order to make sure that this problem is solved. Other things to include or to consider are assessing the extent to which the problems exist and the need and the necessary steps to take. Then assessment of the available resources, examining and choosing of alternative intervention strategies. All these are very, very important when making your planning towards any meaningful health program. Monitoring is very, very crucial as well as evaluation of the results of the intervention. So those things are very, very germane in health planning. Well, there are other things that must be considered too, such as your planning must consider the people's culture and tradition. There must be respect for people's culture and tradition. There must be clarity in your preparation and presentation. Simplicity of health information is very, very important. Instruction and skills. There must be understanding, especially on the topics to be choosing. Reliability of the source of health messages. Acceptability and adaptability of health information skills. Then there must be effective communication between the organizer and the people. So all those things are very, very crucial when talking about planning for a program.